Hi, I'm Dr. Sarah Monet, and I'm here to talk to you a little bit more about long-acting reversible contraceptive methods. I think important to talk about that just in the setting of having changes in reversing the recent laws on Roe versus Wade. I've had an uptick of patients really asking about options that go beyond birth control pills, beyond condoms, and I think this is a good segue to talk about those options. We can really talk about it in one major category. The category would be in the setting of something called long-acting reversible contraceptives. These contraceptive methods can be then broken down into parts where one segment would be that IUDs or intrauterine devices, and the other segment would be a subdermal, actually subcutaneous insert rod called Nexplanon. In the IUD category, there are two IUDs that are worldwide known. One of them is a non-hormone containing IUD called the copper or Paragard IUD, and then there is a segment of IUDs called progesterone containing IUDs, and the more common device names for those would be Mirena or Kyleena, and then there's one on the market still called Liletta, all of them progesterone containing. Those IUDs that are used on the market differ in effectiveness and longevity in use. So the progesterone IUDs, they're in use for now 7 total years. The benefits of a progesterone IUD versus a non-hormonal is that the progesterone IUD will help prevent you from having heavy bleeding, menstrual periods, which would be so much more lighter because the progesterone is acting to thin out the menstrual lining. So there are benefits there really for cycle control and limiting menstrual periods. Again, a total of 7 years of use. Mirena being the biggest product, and then the smaller version of it called Kyleena is what we're also using in the office, and then again, Liletta. The copper IUD, the Paragard IUD, is 10 years of use. It will make no change in your cycles. Your cycles will continue on at same level of flow, same length. Because it's non-hormonal, it will not thin out the menstrual lining, so there's no change in what you'll see there, but both IUD types, the progesterone containing and the copper IUD, will prevent a woman from having egg and sperm meet. It still allows you to ovulate, but the prevention of pregnancy comes from preventing egg and sperm from meeting. It is also used, IUDs have been used, the copper one especially has been used for post-exposure prevention in pregnancy, meaning it acts very similar to Plan B. You can use it if you've had unprotected sex and you don't want to have an unplanned pregnancy, and use it within the first 72 hours from unprotected sex as a prevention to not get pregnant. So in emergency contraception, the copper IUD can be used like that, but not the progesterone containing IUDs. So let's switch gears and talk about the Nexplanon Option. The Nexplanon Option is a 2 to 3 inch device that's inserted right underneath the skin in the inner arm. It goes right here. What that option does is it allows for progesterone within the device to be slowly released and absorbed by your body. So insertion would be numbing up the skin and using an applicator to slide it right underneath. Time of use is about 3 years. Actually, some women can use it slightly longer, but we recommend 3 for optimal efficacy. The progesterone in that device allows, very similar to the progesterone containing IUDs, menstrual lining thinness, so that the periods when you get them are initially spotty in the first few months after placement, but then very light from that point on. The efficacy of it is above 98% in efficacy of use in preventing pregnancy, because there is prevention of ovulation, and there's also allowing for the menstrual lining to be very thin. And with compliance, it's wonderful to have an option that you're not thinking about to replace over 3 years and not taking something on the daily for a pill, unlike the birth control pills. Overall, I think they're great options, all of them. They allow women to have contraception without having daily need to remember to take a pill. So the efficacy and use is fantastic, and the reversibility in all of those options are wonderful when someone wants to desire having another baby or desire pregnancy for the first time.